So there are some issues throughout pregnancy that can be quite common, and one of those is pelvic girdle pain. So let's talk a little bit about that.
Well, pelvic girdle pain is basically pain that affects the pelvic girdle, which is our pelvis joints. And it's very common in pregnancy. I would expect somewhere up to 60 to 70% of women would actually get pelvic girdle pain. So it's quite common, it's just in different degrees. So the actual pelvic girdle that we're talking about are the joints, the pubic symphysis, which is the joint at the front where our pubic bone is, and then our two sacroiliac joints at the back of our pelvis. And they're the joints between the sacrum, which is the bone at the bottom of the spine, and then the two halves of the pelvic bone. And pelvic girdle pain basically is pain affecting those joints as the pregnancy progresses, where there's a few different reasons why it does happen, but the actual, what usually happens is there's a change in the hormones while we're pregnant, which actually creates more movement in our joints, and these joints in themselves shouldn't move very far, so that can create more pain because the muscles try to guard around the area. And also because our abdominal muscles start to stretch, obviously, to make room for a growing baby, and they're in a less functional position to be able to create stability around our pelvis. And so because of that, we tend to see the pelvis generate pain through those joints as well.
Yeah, right. Okay, so in terms of the feeling of pelvic girdle pain, where are you sort of feeling in your body?
So typically you can get pain right over those joints, so right on the pubic bone,
Front,
also at the back, at the low part of the pelvis. Some women also feel pain come right up underneath the perineum or the saddle area, and you can actually get referred pain down your leg as well from it too. Right. So that's also a common thing that I'd see in my practice.
Okay, so say that I'm planning to become pregnant, or I'm early pregnancy and I don't have this yet, but I'm nervous about potentially getting it.
Yep.
What are some things that I can do? Is there anything I can do to help reduce my risk?
For some women it is inevitable, but definitely to reduce your risk, generally what I see are the women who are stronger leading into their pregnancies, they're far better off. Mm-hmm. And in particular, you really want to focus on gluteal or buttock strength and abdominal strength as well. So if there were two areas that I particularly work with women, especially if they've had pelvic girdle pain before and they're planning on another pregnancy, I'd really encourage them to focus on those particular muscles to build up their strength to help prevent that actually happening.
Yeah, great. And say that I am a pregnant woman that has pelvic girdle pain. Yep. What should I be avoiding?
Well, sometimes you can be aware of the things that aggravate your pain, and sometimes you're not so aware. But the classic things that can aggravate the pain are the things that you want to somewhat try and avoid, because the more of that you do, the more it will build up the pain. So the typical things would be when you're getting out of a car, you want to watch that you're keeping your knees together so that you're not putting any extra torsion or extra pressure on the pelvis, on the joints. You'd be aware of pain when you're rolling over in bed, so taking care with how you do that kind of thing. You want to avoid more things that you might not be aware of at the time, things like stairs or anything where there's more pressure on one side of your body compared to the other. Those are the things that tend to set this sort of thing off. And that extra shearing pressure on the pelvis, that's usually what creates the pain.
Yeah, so like lunges as well,
yep.
Or even if I'm standing and I lift one leg up, like a balancing sort of thing. We're really trying to avoid that.
Yeah, so if you, I wouldn't be avoiding it unless you're getting pain. I wouldn't be avoiding it in the hope, if you can exercise and do lunges without pain and you're not experiencing it, by all means that's okay. But we're talking about those women who've already got the symptoms. Those things like lunges would probably set them off. So just taking care, and they're the ones that I would avoid, definitely.
Yeah, perfect. Yeah. And being aware, I guess, of pain during a particular exercise, but also monitoring how I feel after I've done the exercise.
Because it's not always at the time that you'll feel it. Sometimes it is, but sometimes it can get worse later in the day if you've done too much on your feet walking and too many flights of stairs, and you'll be aware of it at the end of the day.
Yeah, perfect. So pelvic girdle pain, we want to try to, where possible, stay active throughout our pregnancy even if we have pelvic girdle pain, just monitoring what it is that we're doing, taking out things that are aggravating it, certainly, and just being mindful of the movements that you're doing, whether it's exercise or actually daily movements like getting out of the car. Great.